cancer is a type of cancer that occurs in the mouth or throat. It looks like a common problem with your lips or your mouth, such as white patches or sources that bleed. The difference between this common problem and potential cancer is that the changes do not go away easily, especially when you do not treat it on time. Oral cancer can spread throughout your mouth and your throat in the areas of also your head and your neck. It likely happens to people that smoke too much and as well drink too much. This is because it can lead to sore in their lips and also cause bad breath. Of course, you know what bad breath is. In no-go area, it can cause a lot of embarrassment in front of your friends or your family members. Oral cancer is a serious illness if not treated on time. So, what are you waiting for? Visit your nearest doctor or visit your nearest hospital to see the dentist. Welcome to the program Health 247. I am your host, Irene Okechukwu. And in this program Health 247, we keep bringing you health-related matters, always making health your priority. And of course, to be part of this show, you can follow us on all our social media platforms on Official Rapid TV and keep watching us on Rapid TV channel 173 or Star Times. See you there and don't go nowhere. For when we return, we will be with our special guest who will be taking us on this topic, oral cancer. He is a dentist, but I keep it on with me. When I come back, I'm going to introduce him to you. So don't go nowhere and sit back.
Cancer is a scary word, but it's important to check in with your body every now and again and know the symptoms, especially if you think you're seeing some warning signs. It's estimated that over 53,000 people will be diagnosed with some kind of oral cancer this year. Early detection is key when battling cancer, but you can protect yourself by knowing the signs and symptoms of oral cancer and knowing the ways to minimize your risk. Oral cancer accounts for about 3% of all cancer diagnosed each year. While that number may seem small, it's still important to know what to watch out for, especially if you're male.
Alright viewers, welcome back on the topic oral cancer. And today we have a special guest. He is a dentist. We have Dr. Mustapha Danjuma, who is a dental surgeon, and he's going to take us through on this topic, oral cancer. Dr. Mustapha Danjuma, you're welcome on the program Health 247.
Thank you. I'm happy to be here.
Alright. Okay, I want to, choosing this topic is something that I know it's not all that common and people do not know much about it. But what people know about dental care is, toothache and other things. And because of that, they only think that people who should take care of their teeth are those who have tooth problems.
Yes.
Now, relating it to other oral diseases, that is the reason I chose this topic, oral cancer. So can you brief us what oral cancer is about?
Thank you very much. And oral cancer means abnormal growth of tissues. This abnormal growth of tissues, it will progressively start attacking other normal tissues in the body. And so oral cancer simply means abnormal growth of oral tissues, which will destroy the functions and have a lot of health effects.
Interesting.
And briefly, this is layman terms.
Okay. So when you talk about abnormal growth in tissues, what could lead to it and what are the types of this oral cancer?
So the oral cancer, it depends on the types of tissue that are involved. That is how we classify them. And we have the most commonest one is we call it squamous cells carcinoma. These affect mostly the soft tissue.
Okay.
But there is also oral cancer that affect the salivary glands. They affect the salivary gland ducts.
Okay.
There is also oral cancers that affect the immune system. They affect the lymphatic system. We call them lymphoma. So there is also oral cancer that affect the bones,
Wow.
and we call them sarcomas. Some affect the cartilage, we call them chondroma.
Okay.
So chondrosarcoma. So this is how we classify them. It's depending on the particular type of tissues that is involved.
Okay, going through the names you've just called right now, I am not a scientist and I have no idea of what you're talking about. So you've been mentioning some scientific names. Can you just break it down for our viewers to understand what you're talking about?
Yeah, you see, if you look at the oral cavity, there is a lot of structures there.
Yeah.
There is the lips, the tongue, the cheeks.
Okay.
There's the lining inside the mouth, the floor of the mouth.
Yes.
So, and they have their own functions. So if there is abnormal growth of tissues, uncontrolled abnormal growth of those tissues, and it will result in ulceration, sometimes it results in sore, it will start progressing to a big tumor.
Okay.
That is a big swelling.
That's
in the oral cavity.
Okay, in the oral cavity.
Some can show inside the mouth, some can even, the growth can be visibly outside the mouth and deform the face of the patient.
Wow.
So it depends actually on the tissue, on the cells that are involved. Is it a bone cells?
Okay.
Is it a soft, that is mucus, that we call it soft tissue? Is it a mucus? It's a mucus. That is the cells that are forming saliva.
Okay.
Is it the salivary gland themselves, or is it the salivary duct? You know, in the salivary gland there is a pipe that brings the saliva to the oral cavity. Is it that pipe that is involved in the development of the cancer, or is it the tissues from the floor of the mouth under the tongue? So, or is it the lymph nodes around the head and the neck, especially in the cervical area, in the neck area. So depending on the location and the type of cells that are involved, that's how we classify this cancer.
Interesting. Okay, going further, what could lead to this oral cancer? Could it be the choice of lifestyle that could lead to the oral cancer?
Yeah, yes, the causes of cancer generally is not known yet. The scientists are still researching.
Okay.
But there is other factors, we call them predisposing factors.
Okay.
Lifestyle is part of it.
What type of lifestyle?
Good. Lifestyle, like the types of food we take.
Okay.
You understand? Especially food that have some preservatives, and these preservatives, some of them, they are carcinogenic in nature, although the NAFDAC, like in Nigerian case, and other regulatory agencies are trying their best to ensure that all preservatives that are carcinogenic in nature, they are not part of our food now.
Okay.
But they have, and there is also even cosmetics.
Oh, really?
Even cosmetics.
Wow.
And yeah, and being take too much refined foods. You understand?
But there are some people that say that even taking much of alcohol and smoking could lead to that.
They are risk factors.
Okay.
Alcohol, smoking, like poor oral hygiene, malnutrition, lack of immunization, access to healthcare system. All these are factors that can predispose patients to development of oral cancer.
So, for instance, now, how can the symptom just start? Is it that you just start having swelling in your oral cavity, or you start? What kind of symptom will you experience or will one experience if the person has oral cancer?
Well, the funny part of cancer, it used to start as a painless lesion.
Wow.
Yes. Some in the oral cavity, it will just start as a small sore or ulceration around the gum or around the tissues, the lining of the oral cavity or around the back of your tongue. So it starts as just a simple lesion that will progressively, slowly growing. So any lesion in the oral cavity, any sore or any swelling that is more than 2 weeks, and it does not resolve,
it doesn't retrogress.
Treatment, we take it as a red flag. So we call red flag. We now start suspecting something. So we have to dig in to see what is happening.
So detecting at an early age or at an early stage, can it be prevented or could it be cured?
Early detection is key, because if it is detected early, it can be treated and the patient can survive it. It is easier to treat when it is early detected.
Interesting.
Yes.
All right, viewers, it's been Dr. Danjuma Mustafa who is taking us through on this topic, oral cancer. So if you've been watching, you can do us well by just sitting back while we go on a short break. And when we come back, we'll tell you more on this topic, oral cancer. Alright viewers, welcome back on this topic, oral cancer, and it's been with me, Dr. Mustafa Danjuma. So now take us through on how oral cancer could be prevented, especially when it's being detected at an early stage.
Well, first, improve oral hygiene. Oral hygiene is very important.
Okay.
And nutrition is very important, especially in children and women, as well, because it will boost their immune system.
Okay.
So nutrition, oral hygiene, and nutrition, and access to health care. That is regular dental checkup. If you have any lumps, if you have any sore that is more than 2 weeks, or any cancer, no matter how small it is, I'm sorry to say, any ulcer.
Ulcer, okay.
Yeah, so you have to go to the dentist, check them out properly, and the dentist will be able to meticulously check your teeth. And if he suspects anything, he will take a sample and take it to the laboratory and see what is happening. So it is important to have regular checkup, as I said, at least every 6 weeks, 6 months. Somebody should go to hospital and see a dentist. But if you have any pain or any abnormal swelling, any numb, you should go to hospital for. That is very important.
Okay, speaking about nutrition, what kind of diet will you encourage for persons? You just spoke about nutrition, that's the aspect of trying to prevent oral cancer. And secondly, you mentioned children. So are you telling me that people could get oral cancer at any age? So those are my 2 questions.
Yeah, it can. Oral cancer, it can be seen at any age.
Okay, but the babies? Or those ones that are already patent? Yeah,
even small children can still present it with cancer, though it is common to see among adults, but you can also see in the children.
Okay. So in terms of diet, what do you recommend? Since you spoke about nutrition, our diet should be balanced, I guess. So what kind of food or nutrition will you recommend?
Oh, you see, when we talk of balanced diet, we are not talking that you must have big money for you to eat balanced diet.
Exactly,
no, you can use whatever is available. We have people like soya beans meal.
Okay.
You can do the milk. You can do the powder. We have you can rear your chicken once in a while. This thing. We have egg, we have vegetables around our homes, and we have fruit. Nigeria, we are blessed with all those.
There was something I was longing to hear from you. When we were kids, they told us not to take too much of sugar. So I was thinking you're going to go into that area.
We talk about refined sugars,
Okay.
especially sugars that have sticky character, those that can stick to the tooth surface over time.
Okay.
You also, I don't want to digress from cancer, but when you have those sticky sugars, they can, oral cavity is full of microorganisms.
Sure, sure.
So some of these microorganisms, they depends on the remnant of whatever you take to survive. And they produce their byproducts, that is their metabolic byproduct. That is waste product. And some of those waste products, they are very harmful to
the body.
And can initiate disease in the oral cavity, especially in the soft tissue.
Interesting. So, moving further, what kind of treatment will you, especially those who are diagnosed of oral cancer, what treatments are recommended for them, at least as it progresses?
Yeah, first of all, we have to rule out that lesion, that particular disease we are seeing in the oral cavity, either outside the mouth or inside the mouth. Is it a cancer?
Okay.
Because there is a lot of diseases that looks like cancer.
Yes.
But they are not cancer. So it's only we in the hospital know. First, we have to take the sample of that patient, maybe biopsy. We take it to the lab to look at the types of cells that we see. Are these cells cancer cells? If we now see it and we rule out that it is cancer, then it depends on the stage of the cancer this lesion. Mostly we do chemotherapy.
Okay.
We do radiotherapy, or use radiation to treat the cancer. Then we also do surgery. At the end of the day, we do complete surgery to remove the whole cancer. And then we continue with chemotherapy, rehabilitation.
Okay.
But if the cancer case has it has metastasized, that is, it has
far.
separate other organs. So the only thing we do, if it is a hopeless case, we only do palliative care. Palliative treatment is to make the patient, to relieve his pains and make him feel a little bit comfortable.
But it will not go?
It will not go at that stage.
But can it kill?
Definitely.
Wow.
Kill. One of my patients presented with a case of tooth mobility in Lagos. And he went to the hospital and the tooth was extracted because there is no any sign of
cancer.
And so I was in Lagos. Somebody called me that his uncle was this and that. I said, okay, let him come over and see me. So when I checked, I asked him to come over to Abuja. He's coming to Abuja. We took some x-ray. And even from the x-ray, we know that this is a carcinoma. So
carcinoma means it has gone beyond.
It is a cancer. But the cancer has even separated. We thought that it hasn't gone to the lungs.
Wow.
Because what the level of destruction we have seen. So we refer him to the National Hospital, I think. From there, he was admitted. He gave up the ghost. It was a very painful, but it has gone beyond
beyond repair.
Yeah. Because once it metastasized, when it gets into the bloodstream, it starts getting into other organs. It will be very difficult for you to control it.
But there's someone that said, I'm not really someone here. I heard that this oral cancer, even HPV, can lead to oral cancer. How true is that?
The human papilloma
virus, yes.
It is one of the predisposing factors of oral cancer. We also think of HIV/AIDS. People that have HIV/AIDS, they have suppressed immune system. The same thing with papilloma virus. So you expect that the immune system is weak,
Okay.
and the body can decide to react, and the tissue can start multiplying, and they can be uncontrolled, and that can lead to development of cancer.
Wow.
Yes.
Okay, out of this, there's a question I want to ask you as a dental surgeon.
Yes, ma'am.
This oral cancer, can it be can it be transmitted? For instance, if your boyfriend or your husband have this cancer, maybe if he kisses you or something, I don't know, can you as a partner get it?
Well, cancer is not transmissible disease.
Okay.
Yeah.
No, based on the symptoms actually.
Yeah, because it is a overgrowth of tissue. It is not microorganisms that cause it, so that you cannot transmit the microorganism from one. It is not a pathogenic.
Okay.
You understand? It is abnormal growth.
Abnormal growth. Okay.
So I have not seen any case of transmission of cancer.
Not actually cancer per se, based on the symptoms, like when we are calling things that could lead to oral cancer, such as we've mentioned HPV, HIV, we mentioned also there are a lot of factors we mentioned though, that's why I'm asking, can it be transmitted?
You can
transmitted?
The cancer itself
Okay.
cannot be transmitted actually.
Okay.
But the other predisposing factors, like the disease that can be associated with the development of cancer, you can, since it is a pathogenic infection, you can transmit it. You can transmit HIV virus.
Yeah, sure.
You can transmit human papilloma virus, HIV, from one person to another. But nobody can tell you that you can transmit cancer. To this thing.
So viewers, this is our topic on oral cancer, and as you can see, he has told us much more on what we need to know on oral cancer, and now he's going to just tell us what we need to do to avoid it, and he'll give us recommendation on what we need to know. So tell our viewers, give our viewers a word of advice or recommendation on this topic, oral cancer.
Oral cancer, like any other disease, one need to have a very good health habit. We have to reduce our alcohol consumption.
Okay.
Tobacco, cigarettes, smoking.
Smoking, that's reduced
because these are all predisposing factors.
Okay.
And we need to also eat healthy, in terms we eat most of our natural food. Not canned food or this thing. And it's also very important to, as I mentioned earlier, to have regular checkup. If you feel anything that you don't understand, if you have any swelling, you have any sore, any kind of ulcer, or any numb, even if that is not painful, you have to report it to the hospital. And for children, you have to immunize children properly.
Okay. What about immunization?
Of course, immunization of all killer diseases.
Okay.
We have not seen immunization against oral cancer yet, but there is our cervical cancer, breast cancer.
Sure.
I think with time they will come up with the oral cancer vaccine.
Pray
so we hope
it
will come. Since they have started achieving, it will come. So it is important to have a very good lifestyle, good health-seeking habit. So somebody should not just sit down until I had pain. You have, even if you have, you go to the hospital. You don't have at least every 6 months. You visit a dentist. The dentist will check your teeth, check your tongue, check your lips, check everything around the mouth
So that means after
and
this, I'll meet you
advise
so that you will check everything.
Of course, you are welcome.
All right, viewers, this is the time we come to the end of this episode on oral cancer. And as usual, if you want to be part of the show, just keep watching us on Rapid TV channel 176 on Star Times. And you can follow us on all our social media on Official Rapid TV. Dr. Musa Danjuma, thank you for coming on the program.
Thank you.
Yeah, you're welcome, sir.
You're welcome.
So, viewers, as he said earlier on, we should try to visit our dentist at least once in every 6 months. And as well, he said we should reduce our intake or too much intake of tobacco. I think he also mentioned stop drinking too much. There are some people that drinking is a habit for them.
Reduce.
So reduce your drinking habits. As well, smoking too. People love to smoke. They say like this season now, it's so cold. People think that smoking is the best for the season, but it's harmful to your health. So this is the point we come to the end on this topic on oral cancer. See you and next time in our next episode. I am your host, Irene Okechukwu. Keep watching Health 247, always making health your priority. See you and bye-bye.